他才40岁啊，那时候说你怎么都想不到。
It felt like someone had just severed my arm, kind of like that feeling of loss. We didn't really have suspicions of his mental illness until I became sick.
他会突然冲到街上去，不管那个街上面的车是怎么开，他完全已经没有理智了。
Much after he had passed, right, my grandpa would tell them like, oh, you know, he's well, like he's doing okay. He's living with his wife and daughter in the States. That just shows how deep-rooted the stigma, you know, in our culture, in our community really is.
Things got to the point where I couldn't take it anymore, and I tried to take my own life. And they asked me why, like how could I feel this way when I have everything that they've given me, when I have a house to live in, when I have clothes to put on, when I have food to eat.
我的兄弟，如果妈妈以前有什么对不起做的对你不好的地方，请你原谅妈妈。只要你肯跟我说话，肯告诉我为什么，我会去改。
After I heard them say that they loved me, I started crying. I was just feeling like very loved and seen for the first time in like a long time.
美国小孩他不理解我们当父母做父母的对他那种爱是藏在心里头的。
那从来都是一个禁忌的话题，就大家都避而不谈的嘛。
I try to bring up mental health with my friends whenever I can. I try to tell them, you know, you're not alone. This is very common, you know.
就是我们这样讲出来，也是帮助别的个家庭，帮助别的患者。然后大家共同来面对这个问题。
I just want to share my story because I don't want anyone else to feel like they have to suffer in silence.
Hi everyone, welcome to our webinar, Chat Together, Building Emotional and Relational Health through Child-Parent Theater. Thank you so much for joining us today. So my name is Franzel Tablin. I am part of Chat Together. I recently received my bachelor's in psychology and neuroscience, and I'm hoping to enter the field of clinical psychology. And I will also be one of your hosts for today, along with my wonderful colleague, Peggy.
Hi, everyone. I'm really excited to be in this space with you today. My name is Peggy Wong, and I am a nursing student at the Yale School of Nursing. And I look forward to hearing more about this panel today. Thank you.
Thank you, Peggy. So this presentation was created through a collaborative effort between UCA WAVES and CHATogether. And before we move on, our hosts from UCA WAVES would like to say a few words. So I'm gonna hand it over to Jennifer.
Thank you so much, Fran. Hi, everyone. This is our second time collaborating with Yale CHATogether. If you might recall that in March, we had another webinar in response to the start of the war in Ukraine. And we had such a meaningful experience partnering at that time. And we are so excited to present you with yet another webinar with this spectacular team. So thank you all for attending. And I won't hold this up any longer. Thank you.
Thank you, Jennifer. I would also like to provide a brief introduction of CHATogether first, which is a movement that aims to provide a platform to learn about coping strategies in Asian child-parent conflicts through interactive theater, and to also address mental health barriers through research, public education, and community engagement. And a more thorough introduction to CHATogether will be presented shortly. So I will now provide a quick summary for today's agenda. First, we will have our welcomes and introductions. Then we'll present our skit titled Parents Have All the Solutions, which is followed by a panel discussion with our amazing mental health experts. And lastly, we will have poll questions that we would love for you to answer. A quick and important disclaimer before we begin. This webinar is not intended to provide medical advice, but to provide a platform for discussion, as well as to increase mental health awareness. And if there are any immediate health concerns, we encourage you to please direct them towards your mental health provider or primary care doctor. If you're more comfortable remaining anonymous in the chat or the Q&A, please feel free to change your Zoom name to anonymous. And lastly, if there are any questions that you'd like to ask the panelists, please direct them towards the Q&A box, and the chat box can be used for general comments, thoughts, and logistical problems. Next slide, please. So now I would like to introduce you to Dr. Eunice Nguyen, who is a child and adolescent psychiatrist at Yale New Haven Hospital and an assistant professor of psychiatry at Yale School of Medicine. She is also the founder and director of CHATogether. And I will now pass the mic to Dr. Nguyen, who will provide you with more information about CHATogether.
Thank you so much. I feel today is such a special day, and May is such a special month to be AAPI Heritage Month and also Mental Health Awareness Month. So with all that, like, it is the perfect time to talk about AAPI mental health. And thank you so much for this partnership opportunity with UCA. And this is the time we want to introduce what CHATogether and bring in this like innovative way to talk about mental health. So Yale CHATogether acronym stands for Compassionate Home, Action Together. And we are a co-op organization talking about AAPI mental health. It is an initiative that started since pandemic started. In response to the anti-Asian hate crime, we realized the unique emotional distress faced by Asian American family. And in CHATogether, in many ways, we use several forms of artistic outlet in a way that creating a sort of in less stigmatizing way to talk about mental health. And I will introduce that one by one. It is one of the arms that we do is using a lot of interactive theater to address the cross-cultural issue in Asian American family. We are culturally oriented. We aim to promote healthy child-parent communication, emotional wellness, closing the acculturative gap that happened in many Asian American families. And we hope that we can break the stigma one day. We can talk in a conversation together. Next slide, please. So this is the 6 arms of CHATogether. As I mentioned, one of the arms, number 1 is the theater arm, where we have a member using our own personal story, create a narrative, a storytelling about the experience with the family. And we also turn that into a dialogue, into an acting. So at a dialogue of a child-parent conflict. We do the skit writing, we do the acting, and we create the video share on social media. And instead of hiring professional actor, we do it by ourselves. And I think like the process of the skit development itself, we already provide a therapeutic reflection opportunity for many of us. So, so the next arm, we also have a lot of teaching point from this working skit. The teaching point, we express that in multiple ways, a more highlighted way, such as emotional flashcard, talk about how parent may express emotion and that translated in different multiple languages. We also have graphic novel, infographic, and share on social media. And arm number 3, we also have research arm, where some of the teaching point that present from the skit. We have several running projects about the qualitative and quantitative type of study addressing those, and we present that in many academic conferences as well. And arm 4, we also have peer support arm, like webinar like tonight. We collaborate with many community organizations such as wonderful UCA and also other academic institutions. So as a way to serve the community and providing peer support. And we have an audience such as parents like many of you guys, and also mental health provider, college student, teenager, high school student, etc. And arm 5, we also collaborate with AAPI artists. It is one of the new line of study that will collaborate with many of the artists in New York City and also from Hong Kong. And so many of the talents, such as like performing arts, like making sculpture, painting, using the art talent to interface with mental health, like sharing the story about mental health, the story, the narrative about immigration, and the conversation with the parents, etc. And lastly, we have our arm. The 6th arm is really, we did not intend to do that. It is AAPI mentorship arm. We started as myself and a few undergraduate Yale student, and eventually we expand to a cascade of high school student, undergraduate student, medical student, healthcare professional student, trainees, junior faculty, and senior advising faculty. So a cascade of people who are also multiple discipline too. We have people who are architects, who are artists, who are medical provider, many of the different disciplines with a common denominator that we truly care about the AAPI community and mental health. And we are united together with an altruistic way to paying forward to the community. So that's what CHATogether is. And I think it's important to mention it because of the AAPI Heritage Month. We create the cultural pride and help identify the cultural identity for the next generation. Next slide, please. So this is like some of the really example that what we do. Again, like this is the theater arm that we show the social media post on share of this skit video that we made. And tonight we actually will live perform this skit. Parents have all the solutions. So stay tuned about after the introduction. Next slide, please. So this is some example of what like teaching point we present using flashcard. For those of you who are mental health provider, this is the example of showing the lay language of mentalization. How do we help to think in the shoes of your child? 同理心, how can I really imagining in a really curious and non-judgmental way, and also thinking in the shoes of my teenager, 17 years old, instead of imposing what I as an adult mind. And so one of the mission of what we try to do really to translate some of those clinical, practical, psychological concepts into someone who can understand, can practice in the daily life. And we translate that into multiple Asian language share on the social media. So next slide, please. This is another one showing the concept of cognitive behavior therapy, of how we can, using these tools before we even talk to our child. So the 3 are addressing the feelings, the thinking, and the behavior. So again, like we kind of an example that's showing something practical tools in a lighthearted way to the community people to understand. Next slide, please. This is another way I want to introduce one of our wonderful, talented artists in our CHATogether team, Lily No, currently a graduating medical student and also pursuing master in public health in Colombia. She utilized the combining graphic novel and to express AAPI mental health. And this is illustrating the same concept of mentalization in an immigrant family. Next slide, please. And this is the research arm, just to show example that, hey, like we also publish paper to, show some of our project. This is the recent publication that we did, understanding the biology of immigrant stress. How can we be a better clinician for immigrant families? Next slide, please. And in the past 2 to 3 years or so, we not only myself, but also the team of CHATogether have presented our work in many academic conferences as a way to advocate for AAPI mental health. And so including some local Yale, New Haven talk, and also nationally professional mental health professional organization like ACAP, APA, Asian American Psychological Association, also in the field of humanity, international conference, also health equity and social justice conference, etc. Next slide, please. And this is the peer support arm where we do webinar like what we are doing at the local level, in a national level, and sometimes we collaborate overseas as well. I guess webinar bring us everywhere in the world, just the difference of time zone. Next slide, please. This is the example of how we collaborate with AAPI artists. This is a filmmaker from Hong Kong. We actually like slightly introduced this project, which is pretty cool, called Film Stylo. And so this is a collaborator named Jeremy Hung, who actually a filmmaker who teach teens to use the iPhone to making like film video to express the internal experience during the shelter-in-place pandemic time. And so we have like virtual site of this project in New Haven, Connecticut, and Hong Kong, and also recently expand to several other places like in Europe and India as well. So using a creative way to express the internal feelings and talking about this with the parents and exchange this video with other places, with other teens, other peers that experience pandemic. So this is a pretty cool project. Next slide, please. So I pass the time to Frank to talk about what are we going to do tonight. So theater arm, how does it work?
Thank you, Dr. Ewan. So I would like to circle back to the theater arm and go over how our skits work. We essentially use drama vignettes to capture the specific themes of child-parent conflicts that are common in AAPI families. First, we'll have our wonderful actors, Brandon and Ren, act our problematic scenario. Then we'll have our moderator, Dr. Ewan, process the perspectives of both the child and parent. And finally, we will redo the skit, the same scenario, after incorporating effective communication skills, which will become our alternative scenario. To add on, we also have other skits that cover various topics, such as conflicts that emerge from COVID-19, Black Lives Matter, coming out as part of the LGBTQ, mental health stigma, anti-Asian hate, and academic expectations. So before we start the skit, we have a question that we would like to ask through a poll. So what are your feelings when you come across a mental health conversation with your child or parents? Awesome, thank you for answering. So now I will pass the mic back to Dr. Ewan for the skit.
All right. So CHATogether theater present parents with all the solutions. So I want to take this opportunity to acknowledge our skit writer, Kara Beck, who's our CHATogether skit director, currently working at CDC, but like she has a lot of extensive experience in improv, drama, vignette, and things like that. So she helped us to improv together with Alan Lee and Hannah Lee. So Alan and Hannah, they wrote a skit based on the personal experience at home with the parents. And Alan's actually currently a graduating medical student at Yale, matching to general psychiatry next year. I'm so proud of him. And Hannah is currently an undergraduate student at University of Kentucky. So tonight we have two actors, Run Lee, who is currently one of the leaders at UCA and also CEO at Cornerstone Education. She will be the mom actor. All right, that was a fun time at the rehearsal yesterday, so I look forward to it. And Brandon Lee, who is currently our CHATogether Teens Outreach Director, and he is going to graduate high school and going to Cornell as undergraduate study. So Brandon will be the teen actor named Kevin in the skit. All right, so at this time, let's exit out of the PowerPoint, and I would recommend everyone to turn on to the speaker view so you'll have a better effect from the skit. And I also invite Ren and Brandon to change the name to Kevin and Mom. So,
okay, give me a second.
Yeah.
Rename.
All right. Okay, so are we ready? Mom and Kevin?
Yep.
Yes.
Okay, so CHATogether theater, parents got all the solution. Version 1, problematic scenario, action.
Kevin, what's wrong with you? Grandma just told me that you are thinking about hurting yourself. You are really that sad? Are you sure? And you want to see a doctor? No doctor. There's nothing wrong with you. You don't need a doctor. What's wrong? 你到底怎么
My
了？
God, Mom, like, geez, I don't know.
What's wrong with you?
I just don't know. I've been really sad, okay?
Why are you feeling sad?
God, Mom, stop yelling at me. See, this is why I don't, ugh, whatever. I don't know why, okay? The last couple of months have just been really stressful and I don't know how to deal with it.
Yeah, for all of us. 我们大家不都是吗？
Okay, yeah, cool. But for me, I don't know. I've just been really, you know, school's been closed. I can't see my friends. I can't go anywhere. I've been getting so much crap online from like these random people I don't even go to school with. Just these random people keep harassing me about COVID and, oh, it's your fault because you're Asian and comments like that. I don't know how to deal with those things.
Oh, just delete the Instagram then.
I blocked them and I'm not gonna, I can't delete Instagram because that's like, I like it. That's how I talk to my friends.
There's something called calling your friends or rooming them, right?
Mom, no one does that. It's awkward.
But that's because you are awkward.
Oh my God, Mom.
There, I said it. I have the weird kid.
The weird kid. That's so mean when you say that. I don't think you understand.
I'm just being real. These are your problems, son. These things you're making you unhappy. So you need to stop thinking about these internet strangers, and then you won't be unhappy. You won't need to see a doctor, okay? Just don't be unhappy.
Mom, I try to do that, but it doesn't work. It's more than that. And that's why I think I need help.
Okay, I will tell you right now. Just think about other people's lives. For example, there are kids in China who don't have their parents around. They have to do all the housework. They have to go to work and work those jobs and pay them, very little money. And life is super hard for them. You don't have to do that, right? Like, think about that. Your life is so much better. Have some perspective.
I know that. Like, yes, I'm very happy I don't have to do those things.
Good then.
But Mom, it doesn't work.
That's what's wrong with you, son. You haven't tried it.
I have tried it and it doesn't help. And it doesn't make me happier to know that other people are suffering. Like, honestly, it makes me even more sad.
Why? 为什么? Why? When I'm thinking about something sad, I stop to think about how much worse it could be. I appreciate my situation more. Try that.
Like, yeah, I appreciate the house, the roof, having to not be in child labor.
Yeah, so there's nothing to be sad about, right?
But I'm still, you and Dad are arguing all the time. You're always yelling at me. And like with Grandma getting sick last week, like, I don't know how to deal.
But see, she's better this week. She got a shot. She got better. 她不是好了吗?
Yeah, I get that. I know that, but I was still scared and it's just too much. I don't know how to deal with all of those things.
But there is nothing wrong. You don't need to see a doctor. You don't need to think about hurting yourself. There is nothing wrong with you, okay?
My God, Mom, I'm trying to tell you that I need help.
I'm helping you. I'm here. I'm here to help you right now. We all love you, okay? 我们是爱你的. So you will be fine, okay? Just think about happy things. Then you won't be thinking about hurting yourself. And you don't need to see a doctor. 不能去看医生. Just try to be more happy, Kevin, okay?
You don't get it. Fine, I'll try.
Wow, that was like pretty heated conversation. It's incredibly challenging conversation to have Kevin and Mom. So let's stop and reflect what happened. So Kevin, let's go to you first. How were you feeling and what did you think what happened?
Honestly, I'm feeling really frustrated right now. I feel like every time I go to my mom with a problem or I try to approach her and be vulnerable, I'm always shot down and my emotions are always invalidated. And it's really frustrating. I feel like she doesn't see me. She's not seeing my problems. She's just trying to tell me to get over things or to be strong or to just not feel unhappy. And it's a lot more complicated than that.
I see that you're so frustrated. You felt like you're not being understood. You're crying for help almost. You really want to get help. Okay. So Mom, let's go to you. How are you doing? What did you feel? What happened?
Oh my God, my heart is beating. I feel so frustrated too, to be honest. And I just can't understand why my son cannot understand me. Why my son, just cannot be strong like the whole family do. We have generations of generations, we have the, to be, and as an immigrant, we have to be strong. We don't have any other excuse, I think. I just can't understand why Kevin couldn't get it.
So I see that frustration as well too, as if like you really want to help Kevin, but like you're just confused, like how come he cannot do that? Okay, so like that's where we at. So that's good. And like I'm a moderator. I try to be neutral. I'm not pro Kevin or pro Mom, but I want to point out a few observations that like kind of bring up to talk about it. And I also invite all the audience, no matter you are identifying yourself as AAPI or not, imagining together this conversation could happen in your household. What would happen? What would you want to see change? What would you want to do? All right, and join together as a moderation. So I want to point out the language and the emotional expression for Kevin and Mom. So I hear many times, like both Mom and Kevin, like in an immigrant family, that is how cool it is. We live in more than one culture. We may speak more than one languages, which is awesome. At the same time, we also have like, cross languages, cross-cultural issue that could kind of have the communication, sometimes it lost in meaning from translation. So I want to point out that I hear Mom mention what is wrong with you several times, right? In Mandarin or Cantonese, what is wrong with you? Like, 你怎么了? Like, 你做咩? 你搞咩? Like, it sounds pretty neutral. But if you translate the same phrase word for word in English, say, what is wrong with you? With the tone, with the gesture, it could mean slightly different thing or quite different thing. I want to point out that. And Kevin, how did that feel when Mom mentioned, what is wrong with you? How does that make you feel?
Yeah, honestly, just like going back to what I said before, it feels very invalidating, like something that I did was wrong or something is just inherently wrong with me. I feel like she's sort of pointing fingers by saying, what is wrong with you? That there is something that I'm doing that is making my own situation wrong when there are a bunch of other factors that are making me stressed out and making me feel frustrated. And I feel like she doesn't really see that when she says, what is wrong with you?
So it sounds like as if the problem coming from you, something is wrong, something is broken. Okay. Well, I mean, like what we think does not imagine that is what exactly come from Mom. And I want to hear from Mom too. What did you intend to mean when you say what is wrong with you?
Okay, thank you, Eunice. I think it's really, I don't know, I was kind of really shocked when you mentioned that part. I think, you're right. In Chinese, we'll just say 你怎么了? So I didn't mean to charge you or blame you, kind of trying to understand. But when they say in Chinese, maybe in English, maybe, that's probably the language barrier. I just realized, what's wrong with you has some kind of a hint, must be something wrong with you. It's not like, how are you? Are you okay? So maybe I should. So Kevin, I'm so sorry. Mom didn't mean that. I think what I mean is more just checking, how are you? Anything I can help, but instead of what's wrong with you, kind of blame you, start from the beginning. I'm so sorry that kind of gave you that feeling.
Oh, I see. I think that means a lot coming from Mom, like, paying attention and realizing that could happen, that could carry that meaning. And also appreciate the opportunity actually let Kevin know about, hey, this is not one mom, man. It's totally different. Yeah, I hope it is helpful. Okay, another thing I want to bring that up about like reaching out for help. It sounds like Kevin was expressing feeling sad and like depressed, or maybe to the point that wanted to hurt yourself and you want to see a doctor. What does it feel like when you have this conversation with Mom, when you want to see a doctor?
I mean, honestly, I don't see the big deal about wanting to see a doctor. A lot of my friends and a lot of people that I know have therapists, they have psychiatrists, and they're tremendously helpful. And for her to say that I don't need anyone at all to help me through my problems just feels like, once again, she's diminishing my problems and she's diminishing how I feel, because if it was serious enough, then I would want to see a therapist. I would want to see some sort of practitioner to just help me through my problems. And I don't know, it does feel like quite invalidating again, just not being able to acquire those resources that I feel like would benefit myself.
Okay, I hear you. To mom, like I guess many of us are healthcare profession here. We want to hear what could be in the way. We're not judging, of course, everyone have all the good intention, but I want to hear from your perspective, like what could be in the way that, what is the hesitancy there that you feel Kevin is not to see a psychiatrist, not to reach out as of right now?
To be honest, it's really hard to me when I heard Kevin want to see a doctor. It's kind of in our culture. If we go to see a doctor with a mental health issue, more people will think about in the other route. It's kind of a, 神经病 or 精神病. That's something we think it's really, really bad for the reputation of the family that we have someone with that kind of sickness. And also, like I shared at the beginning, I was hoping, because my family always be a happy family, and also we fight for the unhappiness, we fight for the struggles. So I was hoping Kevin could fight for it as well, and hoping that we can, with the help of the family, like I shared, I love you, with the love of the family, we can go over it other than to see the doctor. That's deeply in my side. So I mean, if it was wrong, I was happy to listen to you guys' advice what I should do.
I see. Well, I think like that means a lot to hear from mom, what you get to say, right? Like, I think like it kind of bring up with a really good point. There are many like cultural concept there. Like I would invite Kevin to also imagining. My role is like helping each other to imagine in each other's shoes. Like think about in mom, like how she brought up, like may have totally different value in terms of asking for help, in terms of like when she's not feeling well, like what would be something that she would want to do. And think about that. There's a lot of like cultural concept there. I think at least one concept called stoicism, like 吃苦, like eating bitterness. Perhaps like for the last generation or last generation, they could have gone through a lot of 吃苦, the time, right? Like adversity. Some of them may even gone through a lot of trauma, wartime, refugee, or any of that, like could be entirely different from what Kevin would experience. So I think like thinking about what moms come from, not saying you have to 100% accepting that, but like knowing that where she comes from, then you're not blaming. It is not because she does not want you to get help, but that is what she was brought up by with a certain concept. So I hope that you can thinking in her shoes. Yeah. So Kevin, let me ask you, if there's one thing you want mom to change, if we would have this conversation all over again, what would be that one thing you want her to change so you feel more supportive?
I guess it would be nice if she sort of met me where I was at, like at least she can understand and not try to just immediately solve or like invalidate how I'm feeling. Perhaps like sometimes I just want someone to like listen to me, to my problems, and just know that they're there to support me. And it's sort of difficult when I'm being met with that I shouldn't feel whatever emotions that I'm feeling. And I think it would be nice if, she sort of started off by like listening more instead of trying to shut me down and solve my problems.
Okay, so like before the problem solving step, that need to be a validating emotion step, huh? Okay, that sounds great. So communication goes both ways. So mom, like what would be one thing you want Kevin to change so you feel like this conversation would get more healthy, more productive? What would you want him to change?
Oh, thank you. I think I appreciate Kevin just pointed out what he wants me to do. And in my deep heart, I always feel hurting too when he pointed out, me not listen to him, because I feel I really want to listen and I love you so much. Chinese people, Asian people, we don't show that I love you. We don't say it often, but doesn't mean that mom don't love you. Mom loves you so much with all my heart. So that's the part I want to remind you. Always think about that. Maybe my language, my English is not good enough, but doesn't mean that I don't love you.
I see. So like that, like understanding that this is a translational step there. Mom show love and care through actions, right? So like instead of more emotional words, so like thinking the second step to think about that mom express love this way. Okay, if I could recommend one thing to change, perhaps like just like what mom said, like expressing your love and care instead of the angry tone and the blaming tone. Let's show the worries and caring tone. So like, can we try that again with the same conversation?
Sure.
All right. So version 2, alternative scenario, action.
Kevin, what's wrong? What's happened with you? I heard from grandma that you are thinking about hurting yourself and you are really unhappy and you want to see a doctor. What's wrong?
Oh my God, I didn't think grandma was going to. Mom, I don't know.
What's wrong? 你怎么了? What's wrong?
Do you actually want to know what's wrong?
Yeah, I want to know what's going on.
Are you sure you want to know, actually?
Yes, if I didn't want to know, why could I asking you?
I don't know, to yell at me more because I'm not good enough?
No.
I don't know.
I don't yell at you because you're not good enough. I'm yelling at you because I'm trying to make you better.
Oh my God, Mom. I don't know. I don't know what's wrong, and that's the problem. I've just been really sad, and I don't know how to deal with things.
You have been sad?
Yeah, for a long time now, and it's gotten so much worse with the pandemic and staying home all the time. And like, I've been getting bombarded with all these randos on Instagram that are telling me it's my fault that COVID's here, Chinese virus, and all names like that.
I know that, but just delete Instagram. I don't have Instagram, so I don't got those messages. I don't have those bad feelings.
Mom, it's not Instagram's fault. It's the people.
I'm giving you the solution.
I know, but it's the people on Instagram, and you're not listening. Mom, I don't think you understand how stressful it's been. I'm home all the time. You and Dad are always fighting, always yelling at me. And with Grandma being sick last week, I don't know how to feel.
But Grandma is fine now. Grandma,
Mom, you asked me what's wrong. You want to know. You actually want to listen to me? Because I don't feel like you're listening to me. It just feels like every time I try to say something, you just try to tell me what's wrong.
Okay.
No, but that doesn't make what I'm feeling not real.
Okay, I want to listen to you about what is wrong. I don't want you to be unhappy, but I don't want you to have to see a doctor. Do you understand?
Okay, but I think I need to see a doctor, Mom. There's a whole field of medicine that exists just for this. And it's not fake. It's not just for crazy people or whatever. I just get really sad and I don't know what to do about that. And it honestly makes me want to hurt myself. And I don't know how to not feel that way.
Okay.
And honestly, Mom, I didn't want to talk to you about it because I didn't think you'd understand it or want to do anything about it. And I told Grandma about it just because I got to a point and it just came out, and I honestly just need help and I don't know what to do.
I know you trust Grandma a lot and Grandma loves you a lot. And she was worried, so that is why she told us. Grandma thinks you should see a doctor. But Kevin, I never really heard about, I just heard about people killing themselves because they go way too stressed or some crazy thing. I can't even think of something like that happening to you. But it sounds like people on Instagram and just the whole pandemic are really having an impact on you. And maybe I haven't been thinking about how you are doing from your perspective. Sorry.
I don't know what's wrong with me. I know that I have like a roof over my head and all of those things. And even with that, I still feel like I can't be happy, and it makes me feel a lot worse.
I don't really get what's going on either, but I worry about you. Let's try to figure it out together. How about that? Let's make an appointment with a doctor and I will go with you.
Thanks, Mom. I love you. That means a lot.
I love you. 我非常非常的爱你，妈妈爸爸都非常非常的爱你。
All right, so that's the end of the skit. So like, thank you, Kevin. Thank you, Mom. This is incredible. So thank you. I pass the time back to Frank.
All right. Thank you to our team. That was an amazing performance. So we welcome you to answer another poll. Just wanted to check in. What are your feelings after watching the alternative scenario? We'll wait for about 10 more seconds. Thank you, everyone. Okay, so I think we can move on to the next slide. All right, so before we dive into the panel discussion, I would like to introduce you to our amazing panelists. Our first panelist is Dr. Jessica O. Young, who is a child, adolescent, and perinatal psychiatrist and pediatrician at MedStar Georgetown University Hospital. Her work also involves integrated mental health care and community pediatrics. Next slide, please. Our next panelist is Dr. Sen Xu, who is a fourth-year psychiatry resident at Brown University and Butler Hospital. And he has worked with patients from differing economic backgrounds in various clinical and treatment settings. Next slide, please. Our third panelist is Dr. Janie Tsao, who is a psychiatry resident and received her training from Baylor Scott & White Health. She is also looking forward to further hone her skills in culturally sensitive care and systems-based psychiatry. Next slide, please. And our last panelist is Dr. Zihui Li, and she is a clinical psychologist and a collaborating faculty at the MGH Center for Cross-Cultural Student Emotional Wellness. She specializes in various areas such as cognitive behavioral therapy and treatment of anxiety disorders. Next slide, please. And with that, I will hand it back over to Dr. Yuen for the panel discussion.
Thank you, Frank, for all the introductions. So at this point, let's exit the, there we go. And we are back to the gallery view. So thank you so much for all our colleagues who are joining us tonight. So like, it is very exciting. And then every one of them have their own expertise about the content of we're going to discuss. So as we saw the skit of Kevin and Mom, so like, I want to kind of expand on some of the topic there, and then like each of the panelists join in with what they what the expertise is about. So let's start with Dr. Ao Yang. So in the skit, like Kevin obviously is very sad, depressed, and like even having suicidal thinkings, really worrying, and Mom senses that like he is unhappy. So what would be some best way you can recommend Mom to approach this conversation?
Yeah, thanks, Dr. Yuan. Thanks, everyone, for joining us tonight. That's a very good question. And I'm sure many of you parents out there wonder that, right? Like something looks different, something looks off, maybe they're not smiling, but looks different, right? And so what you want to do is to make sure you're in a good place, right? Like you don't want to check in when you're trying to answer the phone and cook and do laundry, then your attention is divided all over the place. So make sure you're in a place where you have the energy resource to tackle that and to really engage if your child is going to engage with you. And then if you are in a good place, like you have the time, you're relaxed and you're curious about what's happening, then you want to approach and ask your child, is this a bad time to engage, or is this a good time to check in? You know, hi Kevin, mom wants to check in right now. Is this a bad time? Or maybe is it a good time? Sometimes parents like to say, is this a bad time, to give the child a permission to say no, because then they feel like they're more in control than yes, it's a good time and come on in. Sometimes too, it might be helpful to describe what you're seeing, maybe vaguely in the beginning, just like, hey, I noticed something seems to be different. So that's less judgmental, more curious, more inviting, to get them to start talking more open-ended. And of course, thinking of, like, if we want to think about, like, go backwards and think about your relationship with your child. Like, have you ever had a precedence where you talk to your child about something difficult? If you don't, it's never too late to start. It's in Circle of Security Parenting, we talk about it's never too late, and we're just looking for good enough. And so if you haven't really spent time with your child, no matter how old they are, they could be 17 and going to college next year, it's still a good time. Anytime is a good time to start in asking them, what is it that you enjoy? Hey, can I join you in this game or this activity that you're doing, just to build up your relationship so that when times like this happen, you're able to have a little bit of that reserve and go in and have that connection with your child.
Thank you so much, Dr. Ouyang. I think like these are really, really practical tools and skill. Like I want to expand to continue some of the point that Dr. Ouyang have said too, including checking in with your state, right? Like I think we try to demonstrate that skill called mentalization, really to think about how do we really imagining your child and be curious and not judgmental. And in order to do that, like you need to really be in the state that you are at, the state that you are relaxed, you are calm, you are not judging. As parents, I'm one of the parents too. So like it could be stress, it could be like you could be like stuck at the traffic, you could be at the end of the working day. I think this also talk about the self-compassion as a parent as well. And it's okay to talk about I need help as parent. I think that talk about the point of the good enough parent that Dr. Ouyang was talking about too, right? There's no perfect parent, but there is good enough parent. I think that speak a volume to model, to demonstrate the good enough parent, because life could be stressful. Life could have a lot of unpredictable things that happen. It happened to Kevin. It could happen to mom as well. So by demonstrating to saying that, hey, like Kevin, you are stressed. I think mom is stressed too. Like, why don't we figure out together rather than like we are butting head together? We are on the same side of the problem. So I think that is really important to have the concept of good enough parent, and also give yourself a permission to feel as a parent as well. Let yourself like, hey, sometimes mom could be vulnerable as well, especially talking about pandemic situation. It is overwhelming to across the board. And so I feel that it's okay to express that to your kid that, hey, I'm stressed too. It's okay to let them know. It's okay to say you are not okay. I think like another point like to talk about too, the permission for Kevin to know about, hey, sometimes like parents would just want to jump into action, like jump into solution. 我很担心我要做这个 to protect my kids, you know, without bypassing the process of understanding and listening. And I think sometimes I think that is what happened in the skit. So I pass on to the time to Dr. Tao to talk more about how do you respond to emotion, how do we obtain permission from your child to get help. I think that is a very important topic to navigate. Dr. Tao?
Hi, everyone. Thanks for being here. Welcome. So how to respond to emotion. As a third-year psychiatry resident, I messed up on this a lot of times. So if you feel like you're not good at this, don't worry, you're not alone. And after about a year and a half working with the child psychologist, the number one advice that has been a huge help for me clinically has been validation. And you heard it over and over again when Kevin was asked, what do you want mom to change? And he's like, well, it'd be nice if she validated me, or like she stopped being invalidating. And over that word comes up. And so what does it mean in Chinese? If you look it up on Google Translate, there's a lot of different words. But I think the best one I found was 认可. So validation, it doesn't necessarily mean that you agree with the person. You may not even understand, but you're acknowledging that their reality could be a reality. That's it. And just by communicating that, yeah, how you're feeling could be reasonable. It helps you be a safe person for your child and helps them feel like, oh, even if my mom doesn't understand or my dad has no clue what Instagram is, like he or she is willing to try to understand and try to be there for me. And we can go through practical steps of what validation looks like in Q&A. But, one thing to take away is when in doubt, validate. So that's all.
All right, thank you, Dr. Tao. I think validation is really important step in the communication. So making that person feeling that it's the presence and be really attuned, emotionally available for Kevin. I think it is really key, and I think that is very important for us to learn. So the next question, I think very important as well. I think in the skit, we also mentioned Kevin actually sadly experienced cyberbullying related to the pandemic, which is really not uncommon to hear nowadays. And so I know Dr. Lee is working in the school system. So I would like to invite Dr. Lee to give us some advice, for mom. What could she do? What could be she navigate this conversation with Kevin, and what would be some appropriate action with the school that so make mom and Kevin feel safe and validated?
Hi, everyone. So nice to be here with you all. 大家好. I think, gosh, bullying is such a big topic, and it's important, as everybody has said so far, to validate your child's experience. And I think in order for validating, you need to be able to listen to understand. Sometimes as parents, and I'm a mother as well, sometimes we listen to problems or we listen to tell our story. And I think it's really important, especially with young people, to listen to understand, and so that you can validate. And so if your child is coming to you and talking about bullying experiences, whether it's in person or online, I would just ask you to ask more questions. What does that mean? What does bullying mean to you? Can you give me an example of what was said? Can you show me what was posted on the social media? Ask, read it, understand, gather data. I think that's really, really critical. I also think it's important that you know that all schools will have some sort of bullying policy. And my guess is that there's going to be zero tolerance, really. I work in a boarding school here in New Hampshire, and our school is very strict about if there's any acts of harassment or bullying, the school has a set response. And we even have a notion of attack on personhood. And I want to talk a little bit about that in just a minute. But so you may want to find out as a parent, just what is the school's policies and follow-up and procedures. The only thing that I would ask is that, you listen to understand, you validate what your child is going through, and then what you want to do is partner with your child. Just because there's a school policy and procedure, what I don't want you to do is pick up the phone to the principal and start calling people without partnering and talking to your child first. Suggest that, gosh, Kevin, I know that your school has these policies. Do you want mom to call the guidance counselor? Do you want mom to say something to the advisor? What do you think? Because oftentimes your child will have an opinion about how quickly you get involved and who they want to involve, because there's a sense of privacy as well. So the more that you can listen to understand and partner with your child, how do you want mom to help you here? Let's work together to figure out what the next steps are. And I think that will help you build that alliance with your child and not somehow alienate them in your quest to solve problem and to support them. I think it's also important to know that sometimes harassment and bullying are very clear, name calling and outward acts of kind of mean behaviors or attitude. We also want to remember there's a thing called microaggressions. And microaggressions are everyday kind of slight little gestures or verbal comments or nonverbal that are really targeting at somebody's identity. And those slights, whether verbal or nonverbal, can be really harmful, even if the person didn't mean it. We know that intent and impact are very different things. And so as a parent, when we're listening to a child saying, this person said this about me and that really bothered me, our tendency might say, oh, I bet I didn't mean it. Like, that's no big deal. And that may be true. They didn't mean it. Maybe it's not that big of a deal. But for your child, it is a big deal. The impact that it has on your child is real. So as other folks have said, that multiple realities can coexist at the same time. It's not whose experience is right or wrong, but that a harm was done. So how do we understand what that is? And I think a lot of school systems also have responses to things like microaggression. At my school, for example, there's a thing called attack of personhood. It's a little different than perhaps bullying or harassment, but it's, people making everyday comments and slights against someone's identity. And we can report it. We report it to the school. It can be reported anonymously. And you can ask for there to be a response or not. So we really try to give the receiver of those insults a lot more agency in how they want the responses to be. I'm happy to talk more about that, but I think I just want to underscore that point of really listening to understand and partnering with your child when it comes to problem solving.
Thank you, Dr. Lee. This is incredibly helpful. I like that alliance partnership, like especially working with teams, right? Like the sense of control, out of control, there's always like good to provide options and partnering and autonomy. So like that's great. Okay, so another last speaker, like I would like to talk about a question about what to expect in mental health treatment. Like in the skit, Kevin is like questioning, like, like feeling like depressed, maybe like suicidal. That could be pretty concerning. What would be like, so many of our parents may not like, maybe kind of like a new concept to see a mental health provider. What do we expect in terms of the evaluation, treatment, and yeah, what do we expect as a parent? So Dr. Xu, like if you can help us to navigate that question.
Thank you so much, Dr. Wen, for that wonderful question. And again, as everyone has mentioned, thanks everyone for joining in on this wonderful webinar. And it was amazing to see this skit. And I really felt like it was very powerful for me, sort of growing up, and it reminded me of a lot of conversations I had with my parents. And so, yes, it was great. And so I just wanted to start off by saying, as a parent, it can be very challenging and a very scary ordeal to kind of know how to navigate this terrain of mental health and just professional help. and be able to provide support for all of our vulnerable children. And, admittedly, there's a lot of structural barriers that are involved too, like really, really long wait times. You want to see a child adolescent psychiatrist, you might be waiting like 4 or 5, if not more months. Language barriers, of course, and also the stigma, which has already been talked about, can all play a big role in why, we might be wary of seeking mental health providers. Nevertheless, I want to just, emphasize that seeking help does not mean that your child is crazy. It's not a sign of a personal weakness or a flaw. In fact, research has shown that illnesses like depression, schizophrenia, anxiety, bipolar, all have genetic components. And so that's why they also tend to run in families. And so these underlying genetic factors can interact with the environment and lead to a higher risk of the development of psychological illnesses. And so even though we are trying to obtain a better understanding of the biology of mental illness, it's exactly because mental illness has a physiological and a biological cause that certain treatments, such as medications, have been shown and demonstrated to work for a variety of psychiatric illnesses. And so, while mental illness is just as much of a disease as physical illness and can often be just as debilitating, if not more, for the person who is unfortunately suffering from it. And so, we don't tell people with diabetes or high blood pressure that, oh, you shouldn't seek any help or treatment. So why should we ignore those who are suffering from depression and anxiety? Something to think about. As far as treatment is concerned, research has shown that depression and anxiety is best responsive to a combination of both medications and therapy. And both forms of treatment have actually been shown to be relatively effective for the treatment of the illness, but it's also the combination of both therapy and medications that is better than either of these treatments alone, which is why we typically do recommend those who are diagnosed with more, enduring, long-term, severe depression and anxiety to ideally have both in sort of their treatment. And so now, when I talk about therapy, it's a pretty blanket term, but it comes in all kind of shapes and sizes. One of the most well-studied forms of therapy for depression and anxiety is a form called cognitive behavioral therapy, also called CBT. This form of therapy seeks to address the connections between sort of our thoughts, our feelings, and our behaviors. And so the idea is that our understanding of ourselves and how we see the world arises from sort of core beliefs that are shaped throughout our development into adulthood and can influence our thought patterns, and subsequently can influence the way that we react and respond to our thoughts and the actions that we take as a result. And so what cognitive behavioral therapy seeks to do is it addresses these thoughts and feelings that do not serve us well by sort of altering and honing our core beliefs structure and replacing it with beliefs that are rooted in a more realistic and self-affirming mode that can help drive us towards the path to healing. And so medications can also be an essential part of the treatment as well. As I mentioned, the most common being what we call selective serotonin reuptake inhibitors, also known as SSRIs. The thought being that by increasing the amount of serotonin in the brain, this is thought to help facilitate improvement in mood and anxiety. And so it is also important to note that these treatments are not like, they're not going to work overnight. Whether it's therapy or medications, the process of healing takes time, and the results often take weeks, months, and possibly even years, before you begin to see an effect. And so how does this look like in clinical practice? Well, so when your child first sees a mental health provider and they're determined to have a diagnosis of depression, there's sort of a variety of factors that get assessed, including the severity, the length, the nature of the depressive episode, types of treatments that have been tried in the past, and other things that might be going on as well, like other illnesses that might be going on. And so these factors all sort of impact how treatment is delivered and also helps determine what might be useful for each individual. And so although this varies, of course, case by case, in general, for more mild cases of depression and anxiety, we generally recommend therapy as sort of a first line of treatment. So the first thing that you would do, while for more severe or prolonged cases of depression and anxiety, we typically recommend both medications as well as therapy. And so, we can't have a talk about, mental health evaluation without a talk about safety risk as well. And so basically what happens in any mental health evaluation is what's called a safety risk assessment. And so what this means is that your child is going to be asked if they have either recently experienced the presence of any suicidal thoughts or thoughts of wanting to harm themselves, or have ever experienced these thoughts in the past. They'll also be asked if they've ever engaged or thought about injuring themselves, either by cutting or by other self-harming behaviors. And then this information all added up, in addition to historical background information about your child's mental health history, as well as sort of their social structure, the environment around them, and their family history, will also help determine sort of what a general safety risk level is for your child. And I do want to stress that, you know, while no mental health professional is able to accurately predict the risk of suicide in any individual, like there's no way that we can predict who's going to commit suicide, who's not. These safety risk assessments are important in helping establishing what we call like a baseline risk, and determine if, based on future evaluations, if there's an increased risk based on the change in certain factors in their environment or certain stressors in their life. And so anytime that suicidal thoughts get mentioned, we always have to take that very seriously. And we as the providers will work with you and your children to help determine what the best course of action moving forward will be. And so this might mean sending your child to the hospital for further evaluation and more intensive forms of treatment, or also finding ways to increase the frequency of doctor visits and support and supervision around your child at home. And so through a combined approach where we work together with you, we can help better understand the needs of of the children and what might be behind some of these suicidal thoughts and these self-harming behaviors, as oftentimes these thoughts and behaviors can be sort of ways that our children communicate distress and communicate stress to us. And so as parents, you know, sometimes we have to do a bit of the detective work to find out what's going on. Thank you.
Thank you so much, Dr. She is so informative. I think like, you know, knowledge is power, and knowing what to expect. So it kind of really addressed many of the uncertainty there. And I think I want to add to that too, like, you know, going through all the evaluation and treatment and all of that, your child need you to be with them together on the same side to navigate that. And that's certainly evidence showing having parents be the supportive role during the treatment time is a really good protective factor. So I want to pass it on too. So our last question, as we are talking about May is an AAPI Heritage Month. And we know that like Kevin in the skit, who is a second generation children, you know, like really navigating two culture in the family, you know, like maybe he's more familiar with the American side of him, but really lacking the connection with the Asian side of him. So I'm wondering, like all the panelists, everyone, question for everyone, how do we embrace cultural pride as the parents? How do we kind of share some of this experience, helping our culture pass on to our child? Any takers?
I think about my own journey in my culture pride. And I think it has evolved over time. And so my word of advice for parents is be patient. Sometimes we wish that the cultural pride is instantaneous or automatic because we're so proud. They should be so proud, right? But I think it's important for us to also recognize, especially those of us that are first or second generation, that our students, yeah, I'm so used to talking about kids, high school students. I think our children's experiences are different than ours. We have to kind of acknowledge that. And so to understand culture pride is built over time and through experiences. And even if at a certain age your child is not where you think they should be in terms of pride wise, there's still a lot more time. And to not force it, because I think the more you force it, the more you can actually be met with resistance. And I would reflect on, what was your journey? How did you find your cultural pride? And were there moments in your own life when you weren't so sure about your Asian identity and not sure how to grapple with it and navigate it? And how did you manage it? And those are great stories to share with your children. Your journey is going to be like mine, but just this is what I've been through. And what is it like for you right now? And to keep having those conversations. But I think family traditions are important, family stories are important. Any exposure will be, there is kind of a cumulative effect that can happen.
I agree that, Dr. Lee. I think that we might meet for one of our CHATogether new project called Family Storytelling Project, and really inviting our parents to share about, could be as little as what you mentioned, like how do we celebrate certain birthday? How do we, what do I do at my son's age? What do I do? How do I go to school? Like, how do we celebrate things? So like many of that as simple story, and be able to share and cumulative over time, and have our children to be interested about learning more about it. And sometimes I kind of point to the fact that sometimes there are many things in the way as well. I know last generation or last generation, there are a lot of trauma, there are a lot of shame, there are a lot of many things that is like a lot of taboo topic that is hard to talk about. So I think like the first step of bringing the cultural pride, be able to share, be willing to disclose some of the uneasy topic, actually sometimes could be really helpful. Like my kids is actually very curious about like, oh, what does Hong Kong look like with all the tall building? Like, do you live on like 40 story of the apartment? Oh my goodness, how do you do that? Like they get curious, but you want to like think that it is, oh wow, mom want to share with you, and one day I bring you back to Hong Kong to see what it is. Like, I think many of that could be really could be living and really story style to share. Anyone else before we move on to the Q&A and pass on the time to Peggy?
I guess I'll add, because I really enjoy watching Chinese shows. I mean, I grew up watching like 白蛇传 and like 孙悟空, and so those things I don't know, I think they're just on YouTube, like those things you can watch with your kids, and thereby introducing the language and the things that you enjoyed as a child. Of course, the graphics are very old, and they're probably going to be like, this is very old looking, but there are newer ones like 还珠格格 and I love that show, 还珠格格. And then also food, right? So you're going to be eating Asian food, presumably at some point, if not very often. And so talking about like what that reminded you of, like the historical implications, and why you eat dumplings on New Year's, and now you can eat it anytime. But in the past, it's pretty much New Year's, because that's when the families get together and are able to make those things. And so there are lots of little things that, again, if not done, and if not intentionally done, it might be missed opportunities.
So I pass the time to Q&A. Peggy?
So we do have two poll questions we'd like to invite you to complete. The first that we will launch is, the skit was helpful to me as a parent. Great, thank you everyone. Okay, and we have another poll. And this question is, I want to see similar events occur in the community to address AAPI cultural literacy, mental health education, and communication skills with my children. Okay, thank you for that. Okay, so next we'll go ahead and move on to Q&A. I did see a few questions on my end that I think it would be pretty helpful for the panelists to chime in on, and we can take this time to enter any questions that you feel might be on your mind that you want to share as well. We might not be able to get through all the questions, but please go ahead and share them. The first question that I have that I'd like to present to the panelists is, my child is only 8 years old. Recently, I discovered that their classmates are already gossiping about other classmates. There also seems to be a popularity contest among the kids. I was surprised, as I didn't expect this level of peer pressure from second graders. I want to know how I can best support my child in understanding the dynamics of their peers and navigating among their peers. I'd like to open this question to any of the panelists, and if you feel inclined to answer, please unmute yourself and please do.
Yeah, thank you for the question. So I think like this is really common question to hear, especially elementary school developmentally during this time. It's really about peer pressure, about like how we connecting with other peer during this time. So like I would recommend like parents to really work on the communication. I think like what we kind of emphasize this in this event too. How do we really truly listening, really like validating and curious, like curious and not judging, like thinking about, hey, an 8 years old, what would an 8 years old like struggle in school? Like he or she want to kind of work along, like to look cool, to get like really engaging well with the peers. So like I think like really be present with your child, be able to curious and not judging, and let her to go to you and be open about that. So I think like building that connection alliance is really important to be the first step. I pass it on to other panelists to add on this question.
What I might add is if your child is noticing that students are gossiping, I would be curious to ask the child, what do you think about that? You know, when you hear kids talking about other kids, what do you think? How does it make you feel? What brings it? How does it impact you? And try to help the child put some language to their experience. And then I would ask the child, well, what do you think the somebody else might feel if you were the one who was gossiping and you were the one, right? So really trying to help them do perspective taking. What is it to be the person that's receiving? What is it to be the person who is the doing? And really, I think as parents, it's okay to also set some expectations of what is okay behavior and what is not. Because I think young kids especially are going to test things. They're going to test the rules at home. Does it apply here in my friend's house? Does it apply in school? Does it apply here? And there is a little bit of trial and error. And so it's okay to remind them what your rules are. We do not tolerate you gossiping. We do not tolerate talking badly about somebody else. Because remember, that doesn't feel good when it happens to you. So why would we do that to somebody else? And it's okay to remind them of those rules. And it's kind of their job, I think, to test some of these rules and see how they apply. So don't get nervous. Oh my gosh, my child's a bully, or my child is, it's just an opportunity to learn, it's an opportunity to reflect, and it's an opportunity to remind the student, see, there I go again, student, the child, what is the appropriate response.
Great, thank you so much, Dr. Lee. There is another question that just came through. It says, how to encourage our children to open up more and overcome social anxiety after being socially distant for so long?
Yeah, I think this question is definitely relevant because, we are still 2 years later in the time of COVID, and we are still, in this process where people are trying to figure out what's an appropriate time to be together, and is it safe to be together, is it safe to gather? And certainly I've talked to parents who have verbalized that their children are much more isolative and isolated because of just being away from their being away from their peers and being away from other students. And kids, like, they want to play, and they want to socialize, and I think that can certainly be really challenging. And so I think, as everyone has mentioned, that communication can be such an important tool to sort of getting to better understand what's actually going on. And from their sort of perspective, from your child's perspective, like, what have you noticed that's been different about being away from your friends and being away from your peers? How have you felt? How have you been dealing with all that? I'm curious. Like, they might say like, oh, I'm doing fine, and that and that could be a jumping off point too for sort of exploring, well, if there's anything that you would like to talk about, I'm here for you. I'm here to lend a listening ear, because it can be tough sometimes. Like, it's okay to address the elephant in the room, and say, I've noticed that, it sounds like you've been more distant with your friends. You haven't really been talking to anyone lately. What do you think of that? Like, how do you feel? And just, doing it and addressing it in such a way that it doesn't sound like you're saying, it doesn't sound judgmental. You're not saying like, oh, you need to talk to people, or, oh, you need to get out of your room. Like that can be very, tough for a child to hear. So just being very supportive and just opening up the conversation and being and almost like, you're someone who wants to better understand. You're not someone who's trying to fix the problem. You just want to better understand what's going on. So being very open-ended with the question, like, I was just curious, what do you think is going on here? I've noticed that you've been in your room a lot more than often.
Great, Dr. Xu. Thank you so much for sharing that. I think we have time for one more question that was shared. My son is 3 years old and he has child anxiety. What is your approach to raising a child having this type of profile?
That's a great question. I think childhood anxiety is on the rise right now. And it's also not only is it on the rise in terms of incidence, but it's on the rise in terms of just being able to talk about it. Oops, sorry, my light keeps going off. To be able to talk about anxiety. And a lot of times I encourage parents to think about their own anxiety. Usually anxiety travels in packs. It doesn't usually occur in isolation, and kids who are anxious, they tend to avoid. And so as parents often want to accommodate for that, right? They want to be like, okay, well, this makes you uncomfortable, so let's not do that. And so they continue to get reinforced in the habit of avoiding, like, oh, mom says it's okay that I avoid it because she knows that this is really hard for me. So as long as I protest and I don't want to do something, I can keep avoiding until I can't avoid this anymore. And then that's when things can get really, really hard. They can start having depression. They can have low self-esteem, all sorts of things that is down the stream from having an anxiety disorder. So often for young kids, when there is the sense of anxiety, really for parents to please check yourselves, like, how is your anxiety level? And are you avoiding things? And how are you modeling for your child when you have anxious thoughts? Like, do you verbalize your anxious thoughts and then coach yourself? Or do you also have that pattern of avoiding and having someone else accommodate for that? It's a really, really great question because it's so prevalent, and we could spend like hours talking about that, but that's my initial thoughts. I'll let the other speakers speak on that.
I was just gonna say I definitely second Dr. Ouyang's remarks. I've had really young kids come in for depression, anxiety, and what they were actually responding to was their mom's depression, anxiety, that, mom says, oh, it's fine, it's under control. But I mean, the kid can tell it's not. And so I think it would have been easier for the kid if, what mom says and how mom actually feels match up. Yeah.
And I will co-sign everything that folks just said. And I just want to add 2 points. I guess one is be careful about labeling a child's behavior too early on, because that can in some ways put a certain lens and through which you view your own child. And so I would say, especially at that young age, to be collect more data, give it more time, and maybe have different sets of eyes on the situation so that you're not feeding into something that it's your own narrative. The other thing I think about anxiety is that oftentimes anxiety, well, what's anxiety? It's something we're scared of, right? And why are we scared? oftentimes it's because it's a new experience or a known experience. For a young child, it may be helpful to ask, what is it are you afraid of? Well, let's find out some answers, and help them problem solve and prepare so that they can better approach the situation. I can give examples, but I know we're short on time, but I definitely agree that avoidance is not the answer, but to approach whatever is fearful in a stepwise fashion can oftentimes be very, very helpful. And just to, again, put a shout out to cognitive behavioral therapy, that type of treatment can really give folks very specific goal-directed ways to approach something that is scary and fearful.
Thank you so much to all our panelists. We love the time that you donated to us. Thank you so much. Everything you said was very informative. Personally, for me, I really enjoyed the time that you shared with us in this safe space. I do want to bring us to this next slide of resources. I'll go ahead and leave this on the screen for a few seconds for you to take screenshots of with your phone if you want to have this as a resource later on. We do have the National Suicide Prevention Lifeline, the Crisis Text Line, and also the NAMI Chinese Warm Line. Okay. We also have 2 upcoming amazing presentations put on by UCA WAVES. One of them is a convention, one of them is an LGBTQ+ workshop. And I'll go ahead and open the space too for the UCA WAVES leaders if they want to speak a little bit about this as well.
Yeah, hi everyone, it's Jennifer again. So I realized in the beginning I didn't spell out what UCA was. It's United Chinese Americans, for anyone who didn't know. And WAVES is our youth mental health collaborative, wellness advocacy, voices, education, and support. So in July, specifically July 14th through July 16th, United Chinese Americans is holding a big conference in Washington, DC. And we will have a mental health track there. So if you found this conversation helpful, there will be more building on what you have learned today. And we'll have other sessions as well. So there will be parent education. There will also be a short documentary screening and discussion. We showed the trailer for that film at the beginning before this webinar started. There will be a youth-led discussion on mental health among the queer community, as well as dialogue on health disparities in Asian American and Pacific Islander communities. So there will be a lot happening. Those 2 flyers are shown for you to take the QR code. You can scan it, or you can simply go to our website to take a look. And registration is open. So please take a screenshot of these if you can, and we would love to see you in Washington, DC. Thank you.
Thank you so much, Dr. Tu. On to our next slide, I just want to say a really quick thank you to all our volunteers, sponsors, panelists, and most importantly, all of the attendees. Thank you so much for taking the time to be with us tonight. This is also some information about CHATogether. We have the QR code here. You can also follow us on Facebook, or you can find us on the Yale School of Medicine webpage as well. And lastly, we do have some information for the UCA socials. Conveniently, they have everything listed out. You can either email them, find them on YouTube, Twitter, Instagram, on their website, or their Facebook. And you can also join their WeChat here at the QR code located at the bottom. Okay. And that's it. Thank you so much, everyone, for joining us today. I appreciate you all being here, and so much. Thank you so much to our panelists. The information that you shared with us is so invaluable, and I definitely want to say thank you to our actors. You guys did an amazing job. Thank you so much. And please feel free to leave the website, leave the Zoom. I know we're a little over time, but I'll go ahead and end the site in maybe a minute, okay? Thank you so much for your responses, everyone. Yes, thank you to all, thank you. We might have some more events. I do suggest everyone to please check out the UCA website. as well as their socials. They have a lot of amazing events going on. They also have a convention going on. So I do recommend everyone to go to their website or their Twitter or their socials and check out what they have going. Also, we do have CHATogether. I'll go ahead and put our website at the bottom too. You can also find our videos on YouTube as well. So you can look us up on YouTube, and we have a variety of videos on there for you to watch. And they might be beneficial for you to also show your friends and families too. Thank you so much, everyone. I hope you have a good night.